presentation. So and now I'm just going to share my screen with you all. And if you can you guys are doing a great job of staying muted. Please stay muted just so we don't have background interruption. That would be really helpful. All right, so I'm just going to pull up the slides. Let's see. Get this. All right. All right. Can anyone give me a thumbs up that you can see okay? Can see the slides? Okay, great. Wonderful. I'm just going to move this bar out of the way. All right. So we're going to be talking about ketamine-assisted psychotherapy. I just want to say hi. If I haven't met you, and I am seeing many new faces. My name is Lauren Going. Thank you for waving. It's nice to have some interaction through the screen. I'm a co-founder of Inner Path Wellness. We are based in the north part of Baltimore City. We are the first psychedelic assisted therapy center in the Baltimore region. We're super excited about that. Ketamine assisted therapy is really the only substance that produces psychedelic effects that is legal to use with therapy currently. So that is the main modality that we're using at the moment. I won't go into my interest in this field because I probably could talk for at least an hour about that, but I will say I've worked in the psychedelic field for over a decade. My interest at first was really around integration, helping people integrate their psychedelic experiences. I've worked with a lot of folks from Hopkins who have done their studies as an integration therapist. That's where my interest started. And I've worked with a lot of people who have done a lot underground work and have come to me for integration work. My background is in trauma. I'm really focused on how to create trauma-informed and safe experiences for people where they can have deep healing in an above ground setting is really my calling. So that's a little bit about me. I'm happy to answer any other questions about that in the question time. But just going ahead and moving along. Just want to share this quote, which I really love, by Stan Grof. Psychedelics, when used responsibly and with proper caution, would be for psychiatry what the microscope is for biology or the telescope is for astronomy. So, you know, to me, these substances, they have so much healing potential, but the key is, as is known from, you know, the first wave of this work, that has to really be done with care. You know, really a lot of care, a lot of discernment about who these substances are provided to, when, set and setting, and all these focuses are really key, because one is open so much. It's just as possible for someone to also have a traumatic experience if not done, you know, with a lot of care. So very important considerations. So today we'll be covering a few different areas. We'll talk about these acronyms: psychedelic assisted therapy. KAP is ketamine assisted psychotherapy. So after this point, I'll just say KAP, ketamine assisted psychotherapy. Ketamine treatments, KAP at Inner Path in particular, how we do it there. What is the flow of treatment? What does treatment actually look like? Why is KAP a revolutionary model of treatment, and who benefits? General benefits of KAP, and also what to rule out. Who would KAP not be good for? And also how to choose a KAP therapist, which is also very important. And then we'll take time for questions too. So psychedelic assisted therapy, I imagine you all know what it is if you're here. But basically, psychedelic assisted therapy is combining a psychedelic substance such as psilocybin, MDMA, ketamine with psychotherapy. So it's really that combination together that creates psychedelic assisted therapy. Oop. Keep going here. There we go. So ketamine was first synthesized in 1962. So it's been around a little while. It has a dissociative mechanism. It's known historically as a dissociative anesthetic. It's not, as people will argue, ketamine is not a psychedelic. It's not a traditional psychedelic the way we think of LSD or psilocybin, for instance. But what it does is causes psychedelic effects in the right dose range. In 1970, ketamine received the US FDA approval for use as an anesthetic and an analgesic, and continues to be used as such. It's remained a preferred kind of wartime anesthetic due to its safety profile. There's no cardiac or respiratory depression. It's a super safe substance. So it was often known in wartime as a buddy drug because it can safely be administered from soldier to soldier without training. So kind of an interesting fact about that. It's on the World Health Organization list of essential medicines. The interest, particularly in ketamine for mental health, began in the early 2000s. And what I've been told about that is one of the reasons it began is because ketamine was given to wartime veterans for pain relief. And what they saw was that, it helped to alleviate the veterans' depression and also allowed them to talk more easily about the traumas they had experienced. And so the interest in using ketamine for mental health conditions such as depression, anxiety, and trauma kind of began around that time. In 2019, the US FDA approved S-ketamine. It's a specific patented form of ketamine called Spravato for treatment-resistant depression, particularly. And so ketamine has always been legal in clinical use since it was synthesized. But besides Spravato, it's used off-label for mental health conditions and for ketamine-assisted therapy. Another interesting thing about it is it can be safely used with SSRIs and psychotropic medicines. So that can really help people who have these kind of heavy treatment-resistant depressions or on these medications where they might not safely be able to use some substances such as psilocybin, but they can very safely use ketamine. It can also help people to titrate off their antidepressants as well. It's really helpful for that. So how is ketamine different? Ketamine, a big thing about it, as you know with SSRIs, is it can often take many weeks, if at all, for any symptom relief. Whereas with ketamine, symptoms improve often within a few hours to a few days. So especially for things like suicidal ideation, people often see the difference right away, which is quite remarkable. And then there's a wide range of routes of administration. So some people were asking about this at the beginning. One that many people know is intravenous. So that is one of the main ways that it is used, especially in infusion clinics. It's through IV. In that route, one gets almost 100% of the ketamine straight into their system. IM is intermuscular, and it's about the same amount that someone receives in IM. There's subcutaneous, which is just placed into the muscle. There's oral, there's sublingual, and intranasal. So there's a bunch of different routes of administration. I can go into this more in a little bit, but I will say while we're here on the slide on the subject, at Interpath, we don't actually use IV. I heard, that might be the best route. I think with each route of administration, there's pros and cons. And with IV, to me, one of the cons of IV is you have to have a medicalized setup. So when you have a medicalized setup, many people feel unable to let go and relax because there are fluorescent lights. There's, the kind of floor that you have to easily clean. You're hooked up to this monitoring system the whole time, which is very hard to feel safe and let go for many people. Some people feel very safe in that setting, but many people don't. So at Interpath, for instance, we have our rooms set up kind of like living rooms. They're very comfortable with low lighting. And so we choose to do intermuscular administration because it has about the same bioavailability while we can have a more comfortable setting. So we do both IM and oral lozenges and troches as an option too. And I can explain more about the difference in a little bit, but just want to speak to that. It's also something that's interesting about it is a generic drug. So the actual medicine is pretty cheap compared to other kind of prescription medications. And just a couple studies here, which if people have interest in learning more about both these studies, I didn't include like the details about them, but just kind of a quick overview. So one was listed in the Washington Post, where 72% of patients saw an improvement in their mood after 3 sessions of ketamine assisted therapy, and 38% were symptom free after 10 treatments. So pretty big. And then there was a smaller study among healthcare workers. And this was, I think when I read about it, it was like 15 to 20 people. And it was very similar to the group we have going on at InnerPath. And I could explain more. It's like an 8-week model where you have prep, dosing sessions, and integration. And 86% in that study no longer met the criteria at discharge for PTSD. And they all came in meeting the criteria for PTSD. So pretty wild, very similar to the MAPS MDMA study. And it's actually a little bit better, but this was a much smaller study. So how is KAP different from other psychedelic assisted therapies? I think this is really interesting because when I talk to people about psychedelic assisted therapy, a lot of people are, I think there's a lot of stigma around ketamine in particular. That's what I've run into. And it seems like a lot of people are just waiting for psilocybin assisted therapy and MDMA assisted therapy. And it's interesting when I hear that because I can very much relate. I was originally trained in MDMA assisted therapy and psilocybin assisted therapy, and was very excited for both those modalities, but obviously they're not available yet in an above ground setting. So then a colleague tipped me off to ketamine assisted therapy. I was very hesitant. I was like, I don't know. I don't know that much about ketamine. And now after working with it for a couple years, I can't imagine not working with ketamine. And one of the main reasons is the duration. The duration of a ketamine journey is about 90 minutes to 2 hours, which actually makes it very accessible for people. It's more affordable. It's more accessible to therapists to be there for a 2-hour, right, rather than an 8-hour session. So it's very accessible in that way. There's also unique properties to ketamine. So this dissociative mechanism can actually help with this kind of unblending, this kind of being able to pull back and notice and reprocess trauma and adverse events. And I put IFS because we do a lot of work with internal family systems, if you know that modality. So there's something that really helps one to unblend into really their, from a very meditative perspective, their witness consciousness and notice the trauma without being overwhelmed by the fear and the terror that accompanies those memories and those experiences. So ketamine to me is quite profound for trauma, and I don't think it gets talked about enough. Another thing that ketamine does is it really allows for this new orientation and awareness and connection to the body, which I think for a lot of people can seem confusing because if ketamine is a dissociative, how could that actually help one to be more connected to the body, right? But what I've seen is it actually allows someone to kind of detach and separate from their body. So then when there's this like reintegration that happens as the ketamine is moving into the tail of the experience, there's actually this awareness that appears to develop where people are more aware of new sensations. I actually have one client that it was in the ketamine work that she actually realized how much dissociation she had because she was so blended and stuck in that dissociation. Then when she was able to kind of move out of it and kind of come back in her body, she could really experience the cutoff, the numbness that was there. So it was quite profound. So yeah, really interesting stuff. And I can say more about that if anyone's interested, but just want to move on to get the basics covered here. So to speak to ketamine-assisted psychotherapy, and I say at InnerPath, but I hope generally these points are covered at most KAP centers. Basically, all psychedelic-assisted therapy, really kind of the crux of the model is that it's based on this belief that we all have this embodied intuitive intelligence. That's what I like to call it personally, is embodied intuitive intelligence. Other systems call it like our inner wise healer, our inner healing intelligence. But it's really this aspect of us that knows how to heal. It's kind of similar to if you got a cut, that your body just rushes there with the blood cells and all of that to kind of heal that area. It's not like you need to think it through. It's the body has an intelligence. So this belief is that our system knows how to heal on these more psychic, emotional levels as well. And so really coming from that perspective is coming from a place where it's really client-centered. It's not like the therapist has the answers or there's some wise guru person in this model. It's really about this inner-directed approach to continue to direct the client back to their own inherent wisdom. And it's believed that these substances, such as ketamine, help clients to unblend from the parts that are really covering up that wisdom and really kind of stopping the process of healing. And so by unblending, one can really get back in touch with that inner healing intelligence, and a lot of healing can take part. But it's really not anything by force. The therapist doesn't interpret or direct. They're really deferring to the client's intelligence. And, a lot of therapists say who learn this work, it's kind of like unlearning so much of what we learned in other modalities, because it's really deeply attuning and listening to the client fully and really holding back and noticing the parts of us that want to interpret or kind of guide the session. So another thing about how we offer at Inner Path is we really like to create a ceremonial approach in an above ground safe setting. So that's kind of what's interesting in this kind of new wave of psychedelic assisted therapy that we have is, indigenous cultures obviously have been creating these beautiful ceremonial approaches to working with medicine for thousands and thousands of years. And then we have this Western approach that is very systematic and linear and all of that. So what we're really interested in at Inner Path is how do we bring those ceremonial aspects and really create something, hold something sacred for people in a space that is also legal and follows those parameters of Western psychology and Western medicine as well. And so really our focus is on merging science with spirit as well. And we foremost believe that adequate preparation for these journey spaces is essential, as well as integration, and really believing that integration is where kind of the meat of the work happens, is actually after the journeys themselves. It's how do you take these profound experiences and insights and weave them into your life to create profound changes? Because that's really what it's about, right? It's great to have, these kind of peak mystical experiences, which are very accessible in this work, but then you still go home, your family's still the same, your coworkers are still the same, the trash needs to be taken out. It's November and getting dark. How are you with all of this? That's really what matters. So just speaking a little to the flow treatment. So what does treatment look like? And as you probably guess, you can't just, to me, maybe somewhere you can, but at Inner Path for sure not. You can't just show up somewhere and have a ketamine assisted session. There's really some steps that have to happen to make that happen in a safe way. So number one is the intake, and then a medical evaluation. And this is really to make sure someone is in a place of stability where they can be physically and psychologically safe for this work. And then what we're looking at is preparation sessions that really establish that rapport and safety. And at minimal, we do 2 of those for people that are really, in a good place, ready to go. But for many, we'll often recommend longer sessions, more sessions before the dosing, because in my view, this work is really dependent on the safety. And when you're meeting a therapist, it takes a little while to build that rapport and that sense of safety. And it's only from that place of safety and holding that one is really able to let go and move into this territory. And so that's really, you know, so key. It's really a foundation of this work. And then when all that is established, then the dosing session, we call them the dosing sessions, the KAP sessions happen. And the number, people always ask, you know, how many should I have? And I think of this so individually. You know, there's been these models that are created 3 sessions here, 6, and we need to have these understandings. But to me, this is such a, you know, person-centered approach. It's so individualized. I've met people that benefit with 1 session, and it just is a catalyst to kind of move some things that are stuck. And then they go off and they do their work, and it's quite profound. And I've worked with other people that, you know, we're meeting for 6 sessions, and then they might come back for, we call them booster sessions as needed. It's almost like they discover another piece of work that needs to get done and they come back. And that's a really wonderful way to approach this work. Even thinking of the individualization around how the sessions are spread out. You know, some people it really benefits them to dive deep and do twice a week or once a week. And some people come and then they want to sit with the insights and all that happened for about a month, 6 weeks, and then they might come back for their second one. So again, it's highly individualized. And I get a lot of people asking how, you know, what is this going to look like? And I don't feel like I can really answer that until I meet them. And especially until we have that first ketamine assisted session, because we don't know how they're going to meet this medicine, how this is going to look. And I think after they have that first session, they really understand how to use this modality. And then kind of a treatment plan can be devised. But I prefer personally to wait till after the first dosing session. All right. So I just want to speak a little bit about ketamine infusions versus KAP. So infusions have historically been what has been happening in this country. They are infusion centers, typically always IV. You're hooked up in these medicalized rooms. There are good infusion centers. There are ones that are really doing this right, but there are many that are not doing this in a very safe way. And I say that because I have lots of clients who have done both. I know a lot of people, you know, who have been to these infusion centers. You know, some really consider set and setting. Some really don't. And you're in a room with fluorescent lights and a TV on, and it's really almost like you're getting kind of a ECT for the brain. There's no focus on what the actual journey, the psychedelic journey can cause. And so because the effects are so profound, oftentimes people will have things come up, and some things might be scary or feel distressing. And often at infusion centers, they don't have the support to talk about these things or the space. I had one client who had some really great sessions at an infusion center. And then on her last treatment, you know, she really was distressed and went up to the person, and they basically kind of kicked her out because they were like, we're closing, you have to go, and didn't really provide any other support. And she had to call a crisis line to get some support. So very concerning stories in that way. I think infusion centers can be really good for things like pain conditions, you know, at lower doses where there is a lot of support offered. A difference as well that I mentioned here is depth, because if there's really this therapeutic benefit that's looked for, you're not really going to find that at most infusion centers. People are not trained. There's not typically therapists on staff because typically an infusion center is not offering KAP. So just to say a little bit about that, and I can elaborate if anyone wants to hear more about kind of the difference and what that looks like. I'll just also say that I feel like ketamine gets a bad rap because of the lack of support at infusion centers. That often I'll hear stories where people are like, oh, I know someone that did that treatment and they felt like, you know, they had a really scary experience. Then I'll ask more about it. And it's typically always at an infusion center. They weren't supported, proper integration didn't happen. There's a lot lacking and concerning. So I just threw this quote in. This is by Rick Doblin, who is the director of MAPS, who is doing all the research for MDMA. He said, "It is not the drug, it is therapy enhanced by the drug." So So just kind of off the tails of talking about infusion centers, we're really viewing it as a whole different kind of model when we're viewing it as ketamine assisted therapy. We're not viewing it as, a vitamin infusion or an ECT that's just going to go in and work to change your brain chemistry. This is really about that this substance opens up kind of shifts and makes new connections that allows the therapeutic process to really take hold. So this modality is really about the therapy, and the ketamine is a support for the therapy. So that's a really important distinction. So just to say, why I believe this is a revolutionary model of treatment is because it's really allowing people to access these other modalities that are really powerful and potent in and of themselves, but in a different way. And so at Interpath, we, combine KAP with things like, if you've heard of internal family systems, so really being able to help people unblend from their protective parts to be able to find this compassion, to find this kind of curiosity that can be really hard to find when they're highly blended with protective parts of themselves. So it can really kind of just really kind of like fuel that therapy and really create some profound changes. As I was talking about before, with the greater access to new awarenesses of the body, it can really accelerate somatic body-based therapies. And if you've heard of EMDR, eye movement desensitization and reprocessing, there's some really neat things being done by combining low dose therapy and allowing the EMDR process to happen. So a lot of cool things happening in this realm. So like we were just talking about, some of the benefits of KAP is that KAP appears to soften the defensive system or the protective structure, or really rigidity in clients. And I've heard it put this way with psychedelic assisted therapies, which I think is really beautiful, is that where they really seem to benefit people is around stuckness or rigidity. So if you think of the kind of the DSM mental health disorders that can really benefit from KAP or psychedelic assisted work, it's depressive disorders, it's anxiety disorders, it's trauma, it's OCD, it's these kind of things where there's this kind of like stuck, rigid kind of way of thinking, seeing, behaving in the world that one can't get out of on their own, and they're stuck. And so these substances really allow this opening. It allows new connections to be made that are quite profound. And really, like the word we often use is greater flexibility of thinking, of choices of behavior, of ways of feeling, of tolerating situations. So there's a lot that it can support in those ways. And really at base, psychedelics appear to be able to rapidly introduce neuroplasticity, which probably most of you have heard about and know. In particular, it helps to create actual changes in the growth of new neurons and synaptic connections, the connections between neurons. And ketamine in particular increases two things that help to do this, which are brain-derived neurotropic factor and also glutamate. So there's a glutamate surge that is created. And this isn't just in the actual ketamine dosing session. This actually lasts for weeks afterwards. It's really strong for, up to 72 hours. So that's where integration is really powerful, is like all these new connections are possibly being made, or there is the potential for them to be made. And so actually bringing in new thought patterns, new behavioral changes, new ways of relating to oneself, such as self-compassion, all of these things, this is where shifts really occur, is in that after effect, in that after period. So improving mood, decreasing anxiety, it can improve memory processing. Big thing connected to trauma is all of these psychedelics that we're talking about decrease activity in the amygdala, which is, as you might know, is the fear center of the brain, which really is like the smoke alarm system. And this is really kind of stuck on in people with trauma or easily triggered by certain things in the environment. So trying to process and move through the trauma is very difficult for people when this is going off and overwhelming them and creating a state of terror when one is trying to move through trauma or adverse experiences. That's often why therapy can be ineffective, or it can take years, is like you're trying to actually bring up these things that need to be healed, but then someone actually, the client shuts down. So by decreasing the activity in the amygdala, it actually allows for one to be with the traumatic material in a different way, where it can be processed from implicit to explicit memory and stored very differently in the nervous system. So it's pretty profound in that way. And there's also the down regulation of the default mode network. If you're familiar with that, it's several regions of the brain, which are really connected to being self-referential. It's kind of like our sense of self. And so this can get really stuck, with I am, this person, this is how I do. I get up and make eggs every day, or whatever it is. And I'm just kind of on this default mode and I'm doing all these things. And it's very hard for us often to break out of that. So with that down regulation, there is the kind of like the new ways of seeing of, I'm giving a silly example. I don't have to make eggs every day. I could, I could make a cup of cereal. I could just have a smoothie and sit on the deck. It just starts to open things up to new ways of possibly being, relating, behaving, and much more from there. So what conditions benefit from KAP? So these are probably many that you already connect to it. The major one with ketamine in particular is depression, but in particular treatment-resistant depression. And how that is distinguished is people who have a diagnosed depression who have tried 2 or more forms of treatment. So that could have been they tried therapy, and still meet the criteria for depression. And they've tried, an SSRI, an antidepressant. So they've tried both of these things and they haven't worked. So two tries and it leads to treatment-resistant depression, which I always think that's probably most people with depression. A lot of people with depression have tried at least two modalities in that way, 2 treatments. So that's a big one for ketamine. It's amazing, ketamine in particular, for seasonal affective disorder, because it has such rapid symptom relief, and can then be stopped safely. So it can really serve during this period right now that we're moving into for people who suffer from seasonal affective disorder. It's very helpful, like I was saying before, to titrate off SSRIs. And that's because one can begin to get those symptom relief of the depression, and that can allow them to move off the SSRIs. And it's safe to be on both at the same time. So those are huge. Suicidal ideation, ketamine in particular, is super helpful around that area. We talked about trauma, anxiety, dealing with life-threatening illnesses and the depression and anxiety that can result, end of life. I could talk more about that, but it's really a profound medicine to help people to learn how to die. And so really there's a lot of interest in it around the areas of palliative care, hospice. And when I say teach people how to die, it's really this experience of moving out of the body into pure consciousness. And so, that often when you're new to that can be for many people very scary, but there is kind of an ability, this ability that one can develop in that way. And so I've worked with several people in hospice at the end of life, and it's been, those experiences were my most profound in my life, sitting with people in the ketamine space and the way that it helped them to transition to death. So very, very interesting work. One of the main things I say with ketamine, what is it helpful for? I sum it up by saying being stuck, against that rigidity, that being stuck. I've tried all these things. I'm stuck in this mode of life. I'm living the same life. I want to make changes, but I can't seem to. That's where I see ketamine being this catalyst and really helping people to break through. Especially people who have been in therapy for years and years and years. It's helped them, but they're just kind of plateaued. They can't kind of move through this area that they're very clear about. Ketamine can be very helpful, ketamine-assisted therapy. Addictive patterns and behaviors. We at Interpath have an addiction specialist who actually works with people in recovery. Once they are very much stable in recovery, it can be very helpful when used with a lot of care. OCD, obsessive compulsive, maladaptive patterns, and psychospiritual growth as well. We often forget that. We often talk about these things from a Western perspective of disorders, of what's wrong with you. But something I'm very interested in is how do we not just look at what's wrong with you, but how do we actually look at how we can actually thrive and actually, move into higher states of consciousness, have more joy in our life, more calm, more space. All of these things to me are so important. And we don't really have a place for them in the mental health world. It's all focused on disorders. It's very minimized. So I'll get off my soapbox and move on. Which conditions to roll out? This is specific to KAP. There's not much for KAP, actually. It's pretty minimal, as you see here. Hypertension, but untreated. So if someone, has hypertension and they're medicated, that usually is fine. Cardiovascular disease or an arrhythmia, that, for that kind of thing, someone would really have to get a checkout by their cardiologist, and we would have to see that to feel comfortable. We don't advise with pregnancy. There's no studies and research of the effect of the fetus, so we just stay away from that. Untreated thyroid disease, psychosis, active or recent mania. However, bipolar, where one is in the depressive period, it can actually be greatly helpful. You just have to be careful around the mania piece. And then active substance use. Obviously, don't want to introduce a substance at that time. Caution with severe trauma. This modality does bring up a lot. Really needs someone to be in a stable, grounded place to do this work. And there's some caution around sleep apnea too, but it can also be safe with, a doctor checking someone out in that area. All right, we're almost to the end and 2 questions, but I'll just cover a little bit more. So what to look for when choosing a KAP therapist? And I added this slide in. I've done this presentation before and people have asked about this. So it really got me thinking of, how I would answer that. And I thought it was a great question because it is super important. Again, there's so much trust that you're giving to the space holder, to the KAP therapist when they're holding space in this area. So it's really important to find someone that really not only has the presence, the knowledge, the wisdom, all of that. It really takes quite a special person to hold space. So, just from a logistical perspective, do they have training in this area? Have they received training in psychedelic assisted therapy? If it's ketamine, specifically to KAP, because there's very nuanced things with each of these medicines. Will they be there with you throughout the entire session? That's really key. At infusion centers, at most infusion centers, someone is not there with you for the entire session. They typically hook you up and then you're left. You might have a bell, but if things are coming up, you might not think to even ring the bell and you're just alone in that room. And for some with trauma, especially interpersonal traumas around neglect, being left alone in these vulnerable open spaces can actually be re-traumatizing. So it's very powerful having a person dedicated to you throughout the whole session. Do they have trauma-informed training in some way? And I think this is really important, even if, a client comes and they're not coming with their main issue being trauma. Many people have trauma in their background, adverse experiences, and even intergenerational trauma, or these, these kind of things that they might not have tapped into in their life, but still they're holding at some level in their body, mind, and spirit. So it's very possible that these kind of abreactions, these big emotional releases, can come out in this space, and having someone that knows how to hold that space is big, that they're not afraid of those big emotions, of those big processes, that they know that these things occur like a wave and they know how to move through someone as that wave is rising and cresting. A big one for me is I personally believe, that it's super important for the therapist to have experiences with non-ordinary states of consciousness. And I think even more if it's a KAP therapist, that they have their own experience with ketamine. They've been in that medicine space. Not everyone agrees with this, but I actually think it's essential personally to work with someone that understands this medicine through an experiential lens. A big one, which is subjective, do you feel safe with them? Because if you don't feel safe with them, this treatment is going to be blocked. It's very key that you feel safe with the person that you're with. do they come from a holistic perspective? And what I mean there is, do they consider body, mind, and spirit? You're more than this isn't just mental health. This is, deeply mental, emotional, spiritual health. And they're willing to hold you on all those levels. And do they allow, your input in deciding a KAP session and protocol? This is where it comes back to that inner wise healer that everyone has, and the therapist deferring to that. That is very important. That therapist isn't just saying like, I expect you to come in for these 6 treatments on these days, and that's just what's happening. That they're really coming to what do you think? How did that feel for you? What makes sense for you? And that's a collaborative approach. And do they provide integration? Because again, that aftercare is key, for safety, but I would also say for effectiveness. Where ketamine and KAP gets criticized is everyone can agree through the research that the results initially of ketamine treatments and KAP are insanely amazing. For suicidal ideation, it can decrease it within a few days for over 80% of people. There's been nothing like that. That's really wild. But does that last? No, that does not last unless someone is actually doing those shifts that we talked about, those mental, cognitive, emotional, behavioral shifts in their life, and also social, support outside of that. What does their life look like? Is that reinforcing some of these stuck ways of thinking and patterns? So integration is key as well. All right, I'm just going to mention these things real quick because I think they are unique. I believe our ketamine group that we are just wrapping up our first 8-week session is the first one in the Baltimore area. Super, super excited about that. I know my colleagues I believe they're in Bethesda, Temple and Miranda, they have an acceptance and commitment based ketamine group. So they started one down there, but we've been the first in Baltimore. So we're super excited to be able to offer that. Super excited about the group model because it leads to, again, that increased accessibility. These treatments are not cheap. You're taking up a therapist's time, there involves the Medi-Val, there's all these things. So we really want to lower the cost. And this is one way to do it. So it's an 8-week group that involves preparation sessions together, the dosing sessions, and then group integration. And so not only does it bring the costs down, but it also provides the unique aspect of group healing. Generally, these kind of psychedelic expanded state healings that have happened in indigenous cultures primarily were always done in group because there really is a group healing component. And we say in the trauma field that if you were wounded or traumatized interpersonally, it also takes an interpersonal healing component. So there's something very profound about healing in group. So obviously I feel very passionate about that. Ours in particular is a low dose. So we do a lower dose than maybe an individual session, and it's a led journey. So our focus is really on helping people to unblend, to drop back into that kind of more pure conscious state, and then to relate to parts of themselves and have this experience, and then work together to integrate with the group. So I can talk more about that if anyone is interested. I also want to mention real quick our KAP practitioner experiential. So we set this up for mental health, medical health providers to have an overview of this field because it's so new. What is KAP? And also to undergo an IM, intramuscular ketamine experience themselves. Our next one is in January. I believe it's January 12th. We have 8 spots, but fortunately or unfortunately, it is completely sold out already, which is pretty wild. So that one is sold out, but we will be doing more soon. And I just want to mention that at InnerPath, we have a lot of interest in education. So if you're interested in getting further educated in this field after this talk, if this has sparked your interest at all, please, I think by signing up for this talk, you're on our mailing list. Please look out for our emails. We don't send that many, but we're definitely hoping to continue to create more trainings in the future to help people really learn safe and effective ways to approach this work. All right. So that is all I have. I just want to keep the screen up for a moment so you can see if you're not already in touch with us, if you have Any follow-up, any questions? I am one of the people that check info at Interpath Baltimore. You're welcome to email us there. You can find all our info about all our services at interpathbaltimore.com. We're on social media at Interpath Psychedelics is our handle. So definitely keep in touch with us. So now time for questions. I'm going to go ahead and turn my screen share off and move out of this. Come back. Let's see. Go. Hold on a sec. I've lost how to get you guys back up. Let me see. If anyone is really good at Zoom and can unmute, let me know. Oh, here we go. I see it. There we go. All right. I think now we should be able to get the screen back up with all of you guys. I never use Zoom. Let me see.
Did you stop share?
I did stop share.
You're still sharing.
Oh, I'm still sharing?
Yeah.
Okay, let me see. Okay. Yay, there we go. Thank you, guys. All right. So I see there's a few things in the chat. I'm just going to look and to see if there's any specific questions. So I'm seeing here that Jasmine was asking about the different routes of administration. I talked a little bit about them. Let me know if you'd like to hear more. And I see Peggy here. Hi, Peggy. Thanks for joining. Let's see.
Not a question, more comment.
Oh, okay.
But it supports everything you said, because my client's at a center and they leave her alone about an hour and a half. They said no therapist has ever requested to come and sit. I came in to observe how she's doing. She was quiet the whole time. I had some training through IFSS Institute, but not enough, but enough. You know, I began that training and doing IFS Inform KAP. And it's very helpful, but she goes in once a month and it starts waning that week before. So more interested in the therapy assisting the process rather than her being alone in the room getting this once a month. I mean, everything you say, I'm seeing ringing true in her experience. It's helpful, but it's not enough without the therapy.
Yeah. Thank you. Thank you for sharing that. That's also what I've seen. And the thing I would say about that is, you know, to me, in these expanded states, a simple kind of question, you know, or just, you know, wondering about a certain piece can really just open something wide up, as you know, from other types of therapy too. But in this space, because of the, just everything is heightened, it's pretty wild. I've seen that, you know, I have a lot of people that I work with, they often come to us because we are above ground, you know, so they would never do these things kind of on their own or underground. So many have not had any kind of experience in this way. So many people I've worked with have a lot of fear, have a lot of anxiety about going into this work. And that's a very normal thing. And when I've worked with anyone with any kind of anxiety or panic at the beginning, when there's some like sensory perceptual changes, it's amazing by just a little bit of cue to helping them ground that they can move through that. Where what I see is if they didn't have that, they could easily get stuck in that place. So yeah, I can't stress how valuable this therapy is. So yeah, I'm seeing now, let's see. So I see a question from Jessica about the difference in dosage between ketamine in KAP versus ketamine in a hospital setting for pain management surgery. I don't know if anyone on the line might be able to speak to that a little bit better than me, because I don't really know much about how it's dosed in the hospital setting for pain management. I know some of the dosing for ketamine is lower than what we give, just for pain. I know also with an anesthetic, it's much higher than what we give. It's actually taking someone completely out, but I don't really know exactly how it would add up. I know in our dosing, we're going for a specific range where there is effects that are happening, but they're not actually taking a person fully out, of consciousness. And for many people, we're staying in a low enough range that they can understand our words. They can, still have access to their breathing. At the higher doses of ketamine, you actually don't know you're a person anymore, or that you're in a room. So that's not typically where we're taking people. I see there's a hand raised. I'm just gonna see the next question here. Ketamine is not contraindicated SSRIs, SNRIs. Yes. So yes, I have not run into a medication where ketamine is contraindicated for safety. However, I have run into medications such as Lamictal, where there is a blunting of the effect of ketamine. So when that happens, our medical team, usually what they ask is that people withhold the medication for about 48 hours so that they actually can get the benefit of ketamine. I'm always hesitant to say it's safe with all medications because maybe there's one I have not run into and I don't know about, and I'm always a little hesitant to make a broad stroke statement like that. However, I've not run into any that has been an issue with our medical team, if that's helpful. I'm going to answer this last one, and then I see a hand raised. Let's see. It's Alicia. Hi, Alicia. Good to see you here. Putting a plug in for cannabis as a potential psychedelic to burn through dissociation, especially when combined with ketamine for somatic experiencing work. And it's legal now. Yay. Alicia, did you want to say anything more about that, or does that pretty much sum it up?
No, I just, you were talking about the different medicines that were legal now, and I just wanted to remind us that cannabis is now legal and actually being used in psychotherapy now, which is really, really cool.
Yeah. Thank you.
Yeah. So the PSI work, the Psychedelic Somatic Institute, it uses cannabis and ketamine, and sometimes together, which is really interesting.
Yes. There's a lot of interesting things being done around cannabis, and also the combination of different medicines as well. We're looking into actually having cannabis-assisted therapy at Interpath, but right now we have actually a nurse who is a cannabis coach that helps people actually pick out strains and work with it very safely. And she is about to be on the website in the next week or two. So we're super excited about that service as well.
Also, just wanted to say thank you for pioneering us through this. This is exciting to have your leadership.
Oh, thank you. I think, when you say that, I just think, wow, it's like such a community effort. And I'm thankful you exist out there too, along with everyone else who has interest in this work, because it's a whole new terrain in this combination in this way. Just gonna run through, I see a few questions I could answer pretty quickly. And I don't want to miss you, Shavad. So notable or significant side effects or risks with ketamine. The main ones that I've seen that are more common are nausea. Nausea can definitely come up. That can usually be mitigated by not eating, the few hours before, about 4 hours before. There can be headaches for some people. These are more minimal, I'd say under 10%. Some of the effects that are lasting that day could be blurry vision, disorientation, which is to be expected in the kind of state that you've just kind of come out of. So therefore, driving is contraindicated as well. I'm just speaking to what the way we use at Interpath. There are risks with ketamine. One a big one is with abuse. Kind of like when you're actually abusing ketamine can lead to bladder issues. It can actually damage the bladder. This is not at all possible or a risk when you're using it in the small amounts we use it sporadically in ketamine-assisted therapy. But generally, ketamine is like I was saying before, is a super safe medications. Those are the ones I would speak to that are most common. And then KAP insurance coverage. So we are out of network at InterPath. However, people submit without a network benefits. People are getting that most of the treatment covered without a network benefits, which is super exciting. We also at InterPath have an intern who's now doing ketamine assisted work that brings the cost down to about half of what we're able to offer it at, and the group as well. And you can get reimbursement for the group. So let me jump to Shavad, because I know your hand's been up, and then I'll jump back to those questions. We can go, if you guys are good, you can jump off if you need to, but I'm happy to go a few minutes over.
Hi, Lauren. Thanks again. Appreciate it. Very professional seminar here. So, I want to touch base. You discussed the aspects of the environment that it's in, the lighting, things like that. Is there headphones involved in this, or is there headphones that the client wears?
Yeah, good question. And good to see you. Thanks for coming. Yeah, so music, I didn't talk much about music. Every time people ask questions, I'm like, that's a new slide. I'm gonna throw into this presentation. Music's a really important part, as many of you know, of any psychedelic journey. In fact, some people will say the music was just as much as medicine as the ketamine, right? So, or the whatever the psychedelic is. So what we have set up at InterPath is we have a system where we have a speaker and headphones. So people have options. Some people like to be really immersive at times. We have noise canceling headphones, so they can't actually hear us. We can't talk when those are on, but lead to a really immersive experience. So usually a session can look like someone has the headphones on, they're immersed for a bit, then they take them off and we talk, and then they have them back on, like that. Some people just don't like the headphones, so keep them off. The nice thing about having both on is when a client is in the experience, I can still hear the music they're listening to, so I can stay attuned to what's happening. And that actually, it can sound like not a big deal, but it actually is a big deal because the music is such an important thread.
One thing I want to point out, may want to consider understanding the electromagnetic effects in the room from radio frequencies or electric fields. If they're on a bed right next to a wall, within 6 feet of the wall, they're receiving massive electric fields. And the effect of radio frequencies and electric fields and magnetic fields, if that is the case, can really impact capillary hyperperfusion, as well as major changes in the voltage-gated calcium channels. So that is causing massive worldwide anxiety and whatnot. The radio frequencies that we're all ubiquitously overexposed to, that is just dramatically increasing, but major effects in the not only capillary hyperperfusion, but the changes in the calcium from the voltage-gated calcium channels, causing major anxiety and whatnot. So if there's radio frequencies, in other words, if that music is created from Bluetooth or not wired, you're going to have an artificial effect affecting possibly the journey. And it happens in a lot of medicines, especially 5-MeO. I mean, I've experienced it where it's like, I got to get out of that room and ground outside, literally outside, but in mushrooms and whatnot. But almost quite a bit of psychedelic medicines are dramatically affected by the radio frequencies and the electric fields in the room. So it's something to pay attention to.
Thank you. Yeah. Can you send me some info on that so I can look into it?
Well, yeah, as it's not necessarily directly associated with psychedelic, because that's very hard to study, but it's very well known, the aspects of it, the impact of voltage-gated calcium channels and capillary hyperperfusion are the most commonly understood aspects of interference from electromagnetics or man-made radiation. So yeah, I'd be happy to send you some information.
Awesome. Thank you. Yeah, I'm happy to look into that.
That's all I wanted to mention. Thank you.
Yes, thank you. No, I appreciate it. I appreciate it. So yeah, I just want to jump through because I know sometimes the questions can go on. I'm happy to stay for as long as you're good to answer whatever's here. Would you recommend any KAP or psychedelic assisted therapy training resources? Yes, and feel free after this training. I'll name a few things now, but if you want to hear more or have any questions, feel free to follow up with me. I know, Alicia, you mentioned IPI. I've heard great things about IPI. The two ketamine trainings I've done, one is not happening any longer, but the other one is PRATI, PRATI, which is really, really excellent. Since I've done it, I've known multiple people who have done it and just rave about it. That's based in Colorado. There's also some really great, if you're interested in this field and you want to learn about many different medicines, there is Naropa Institute has a really wonderful program. CIIS in California, that's a really well-known program as well. These programs are quite expensive, but they cover all the different medicines that are really up for legal use in the next handful of years. The one thing I'll say about trainings is we're really kind of in the Wild West. There is no regulation, there is no governing body. So it's very possible someone could get trained somewhere and it might not be recognized in the future. So I think it really does take some forethought of what trainings you do choose. They are typically quite expensive and you're putting a lot of resources in. So I just think that's something to look into, is how reputable the training is, how much it's a cover, and really looking into that, because there's a lot of kind of these pop-up type of trainings everywhere. So I can send anyone more information if you want more recommendations in that area. Let me see, Peggy is asking, does MD have a legal limit to dosages? Inpatient was given a higher dose than in Maryland. No, that's really based on the MD, the prescriber. We also have a nurse practitioner and an MD. That's really based on their discretion. I think they would run into issues of maybe malpractice if they gave like an absurd dose. And so there's really a lot of thought that's given into the dose, because it can be, it can be a full ego dissolution experience if you get too high, and not everyone is prepared for that. So I don't believe there's any legal implications or limits, but I do believe there's considerations around malpractice with certain dosages. All right. Well, anything else while we're here? Any last minute questions? Yeah, I see a hand.
I want to say thank you. Thank you so much. Great to meet you. And Shavad, good to see you. I also just want to pipe in. I think your idea and offerings with the group therapy is brilliant. I have done both private and group, and I think so much happens with the group dynamic that is really special. We have a saying, we are each other's medicine. It's not just the substance, it's the whole experience, and just having support. And I think so many people long for a strong sense of authentic community, and that's part of the healing as well. So kudos to that. I think that's brilliant. And please do reach out and let me know when your next group sitting for the practitioners. I know the January 12th one is full, and that's wonderful. But if there's another one in 2024, I'd be really interested in participating as a practitioner as well. Yeah.
Good to know. And we will definitely have more. And just to echo, thank you for saying that. I think what we're running into now with the group ending, because it's 8 weeks can sound long, but it's time limited, is, what other supports are there if the healing is in community? What other supports are out there once this group ends? And our culture really is lacking right now in meaningful group support experiences. And so that's what we're kind of looking to, is how can we provide ongoing support? So we're exploring maybe like a once a month integration that we could offer for people, or something more ongoing, because really see the need, for that piece as well. And yes, we will definitely do more practitioner experientials in 2024. So I will make a note to let you know.
That's exciting. And thank you so much.
Yes. And if you think of it, if you can email that email address, info@InnerPathBaltimore, just so if you put it there, then we can put you on a list, and I won't forget after tonight, in case, just to make sure those things get connected. I did see a hand up. Yes.
Oh, I just wanted to say thank you very much in person. And I certainly have the same interest as Jamie, aka Melissa. So so thank you so much. Appreciate it.
Yes, wonderful. And same interest with the experiential?
I beg your pardon?
Was the same interest with the experiential?
Yes, correct.
Oh, okay. Mm-hmm. Yeah, so if you think of it too, if you're able to just shoot us an email just to say our admin could just put you on the list, and I'm just afraid I might forget to connect the dots, but yeah, please,
I will do that as soon as we finish with the seminar. Thank you.
definitely. Well, anything else before we go? I had dinner, so I'm not in a rush. Happy to answer any other questions or any final thoughts from the group.
That was very professional. Thank you so much.
Oh yeah, good.
Indeed,
Good.
it was. Thank you.
Good.
Thank you very much.
Yeah,
thank you.
Great
Great.
information. Yeah.
Thank you all. Thank you all so much for joining. I really very much appreciate. And I really love this work. I'm happy to be a resource. If you do have questions that come up after this or any thoughts, feel free to, you can reach me all those ways that we had before. Please reach out. I'd love to connect further.
Good night.
All right. Good night, everyone.
Thank you very much. Bye-bye.
Welcome. Bye, everyone.